I've had previous conversations with the hospital staff, and basically, if you noticed at the end of their PowerPoint presentation, it talked about where do we go from here in regards to the request. The request itself will be put with the other requests that come into the county and be handled like any other request. It'll go through my budget process and it'll come to you with some recommendations. I would like to turn it back to the board to see is there anything that needs to occur between now and May or June in regards to information to the public, or where does this board like to see? Would they like to add anything above and beyond our normal budgetary process in regards to this request?
I would like to see it put on the next agenda.
Is there any reason why they have not addressed the public forum suggestion?
Well, I think they're looking for, that was kind of where do we go from here type discussion. I think that was the end of their PowerPoint presentation. I've had discussions with hospital staff that are open to that type of conversation. I think they're looking for this board in regards to what direction, if any, in regards to that.
I would strongly encourage that.
I think this board had requested the possibility of having some public forums, anything this size that affects potentially every citizen in the county. I think might warrant that. I think there's some questions that we certainly don't have the answers to. Hopefully that you would, and I think it would be important to our citizens to pursue something along those lines, frankly.
I'm in agreement with that also.
I want to add my voice to that too. Although we don't fund the hospital on a regular basis, we've provided some incentive for physician recruitment and that sort of thing. But really, this is a private company. But I would encourage them to have their own forums and let people ask the questions. Let people ask the hard questions and let them see the presentation, or let them hear directly from people who are in the business of running the hospital themselves, because the county's not in the business of running the hospital at this point. I know physician recruitment is important, and our hospital is critical to our community. I agree. I can't imagine our community without a hospital. It's been a long time, and it serves a great purpose. But it may be that the hospital needs to undergo some changes and look at its business plan, call upon the forum group or this management group, get them more actively involved, those sorts of things. But we need to hear, the public needs to hear, as the rest of the folks on our board have said, from the hospital. I think most of us would attend that and have our own questions. That's one thing to say. Is that what I stand?
Don, let's go on to general business.
This will be an item too, I think, that you still wish for me to put on the next agenda for further discussion of the board.
We're just now getting a request today, and give us all an opportunity to review that request and the numbers that are thrown out today, so that we can talk halfway intelligent about this issue.
This would be, I think I heard you say, part of the normal budgetary process of looking at requests.
Yeah, I mean, the requests are due about mid-April from all the agencies. It would fall into the normal process in which I would present the recommended budget to you in June, unless this board chooses to have meetings prior to that. And June is when this board would have its meetings and a public hearing, generally speaking, towards the end of the end of the month. The only other thing, and I know, Mr. Chairman, you're trying to move on, but The only other thing that I would request, when I put it on the next agenda item, at some point, there may need to be an educational process from the county to the public. Not necessarily public forums, but from the county to the public to disseminate information in regards to, although we do not fund the hospital, we are interrelated with them in a couple aspects. One is EMS service. The other is the health department, and you heard it today, the primary care side of it. So one of the things too, I'll talk to you guys individually to see at what point do you think it's appropriate to start discussing what impacts this may or may not have potentially on our EMS and also on our health department.
And I'm looking to you to prepare a presentation so that that can be a part of our discussion.
Okay. Nothing else. I'll move on to the next item of discussion is the closing the package proposed 2011-2012 audit contract with Martin and Starnes. The actual cost itself is basically $39,000. Generally, we'll budget about $225 more. As you can see in the audit contract, it does have an hourly wage if we need to have them do a little bit of extra work for us. Generally speaking, our finance officer, Joy Hines, attempts to budget about $225 above the actual contract amount.
Do we need to take action on any of this?
Right now, if you prefer, the attorney did get this in their packets, but at some point in the near future, we do need, in the near future meaning this meeting or next meeting, we do need some type of action or direction on the audit
It
contract.
might be appropriate to let everyone know that our attorney is having the beginning of Superior Court, and she's involved in that, as normally the sheriff would be here for a presentation of a retired employee, and he also is involved in the Superior Court.
This is something, Mr. Chairman, I was trying to get the finance officer before the board for director-specific discussions, but just due to personal circumstances, we've just been unable to do it in the past few weeks. But we are eventually getting to the point where a decision on an auditing firm will have to be made. Next item of discussion, closed in your package, is a proposed Child Abuse Prevention Month proclamation. If it pleases the board, I'll just read it real quick. Whereas preventing child abuse and neglect is a community problem affecting both the current and future quality of life in a community. Whereas child maltreatment occurs when people find themselves in stressful situations without community resources and do not know how to cope. Whereas the majority of the child abuse cases stem from situations, conditions that are preventable in an engaged and supported community. Whereas child abuse and neglect can be prevented by making sure each family has the support they need to raise their children in a healthy environment. Whereas child abuse and neglect not only causes immediate harm to children, but also proven to increase the likelihood of criminal behavior, substance abuse, health problems such as heart disease and obesity, and risky behavior such as smoking. Whereas all citizens should become involved in supporting families to provide safe, nurturing environments for their children, giving them the opportunity to grow up to be caring, contributing members of the community. Whereas effective child abuse prevention programs succeed because of partnerships created among social service agencies, schools, faith communities, civic organizations, law enforcement centers, and the business community. Therefore, Alleghany County does hereby proclaim April as Child Abuse Prevention Month in Alleghany County and call upon all citizens, community agencies, faith groups, medical facilities, elected leaders, and businesses to increase their participation in our efforts to support families, thereby preventing child abuse and strengthening the community in which we live.
You've heard the proclamation. Is there a motion to accept this?
I'd like to make the motion to accept this proclamation.
Second.
I have a motion and a second. Discussion.